some of the immediate symptoms of a head injury, it can be nothing. Like you can literally just continue to live your life and you may not really notice anything going on. That can be kind of dangerous, right? Because you may have this inflammatory event or this energy crisis, and you may not be perceiving things as being different. Now, I would argue that there's things that we can test for and find to be able to point us to you having a head injury and being able to resolve that. But we need to understand that sometimes the initial symptoms are literally no symptoms. So let's talk about this thing called the energy crisis.
Welcome to the Longevity Formula with Dr. Brandon Crawford. Let's explore the new era of wellness.
Hey everyone, welcome back to the podcast. Today we're going to be talking about a topic that is really close to me. It's something that I see on a daily basis, and believe it or not, this is probably something really close to you too. We're talking about concussion. Not just about concussion, but why ignoring a concussion could really cost you your life, your happiness, your health, your well-being, your relationships, all types of things. This is something that I think everyone in today's society needs to be aware of. I've seen concussions that have gone not just untreated, but even unrecognized. I've seen them just demolish families. One example was a military guy that came back from serving our country, and he had they just thought it was a mild head injury, no big deal, whatever, didn't do anything, didn't tell him to, and it just continued to cause problems, ultimately leading to personality changes, ultimately leading to a divorce, ultimately leading to a huge shift in several people's lives associated with that family. So these are the types of ripple effects that can occur if we don't know what to look for and if we don't know how to address them. So when I say concussion, what am I talking about? Concussion is obviously it's a head injury, right? So it's involving the brain. So this is when you hit your head, there is an energy transfer from that something into this very delicate matter called your brain. And your brain is kind of jello-like, right? So some people may not realize that. So if you even have, let's say an auto accident and you don't hit your head, but you get a whiplash, right? So your head like whips forward and back. This can actually cause a concussion as well, just because of how the brain shakes in the skull. I've literally seen, this is a true patient story. I've seen someone have a very low impact auto accident in a parking lot going about 5 miles an hour, completely sheared parts of the brainstem nuclei and completely changed this person's brain dramatically. So much so that, the medical professionals that he worked with before us were kind of writing him off, saying like, no, this is psychological. This isn't brain related, or brain injury related. This is not what's going on. But it was. And so we treated the brain injury. We identified what was going on and completely changed that person's life. So when it comes to brain injury, we also have to understand, so we have this gut-brain axis that it can be disrupted in so many different ways. And if we even have a mild head injury, a mild bump to the head, we can literally see immediate changes in our gut. We can see inflammation, we can see microbiome changes, we can see gut breakdown in so many different ways. And this can obviously lead to so many different health concerns and issues, but that's a huge, huge problem. And literally in the research, we see the connection, mild head injury, immediate changes in the gut flora. And it's interesting because they really do echo the same findings that we find with acute and chronic stress, right? So if we have an acute stress, we see immediate changes in the microbiome. Just like we see immediate changes, I don't know why this came up in my head, but it did. We see immediate changes in testicular blood flow with acute stressors too. So this is going to have, when I say this, head injury is going to have an impact on every system in the body. The brain controls everything, right? It controls the gut flora. It controls our hormonal systems. It controls how we sleep, how we think, how we move. It controls everything. So if we have an injury, mild, moderate, I don't care. Severe, obvious. Severe is obvious. Everyone knows severe brain injury and they're going to see it and they're going to go, okay, this needs to be addressed. I'm talking about the mild and moderate people where it's like, hey, shake it off, get up and walk it off, whatever, you're fine. Oh, you got a headache, take an Advil. Those are the people I'm talking about. And by the way, I'll say it again, don't take the Advil because that's going to prolong symptoms. Of course, work with your medical providers. I'm not giving medical advice here, but I'm just telling you that there's research that shows if you just squash the inflammation, you're going to prolong the symptoms of the brain injury. So that's what I'm talking about here. We have to understand that every time we hit our head, there can be potential ramifications. So what are the immediate symptoms of a concussion? So most people know, okay, headache, dizziness, confusion, visual disturbances, this kind of thing, right? Everyone knows the classic example of, football player getting hit, small town Texas, or laying on the ground. Coach says, how many fingers am I holding up? And, he holds up 2 fingers and they look at him and say 4, he's good, put him back in, right? But there's so much more that needs to be screened. And I will say, today's teams have a lot better screening process than that. I think it could be a lot better. I know it could be a lot better. But here's what I want you to understand. Some of the immediate symptoms of a head injury, it can be nothing. Like you can literally just continue to live your life and you may not really notice anything going on. That can be kind of dangerous, right? Because you may have this inflammatory event or this energy crisis, which I'm going to describe what the energy crisis is. And you may not be perceiving things as being different. Now, I would argue that there's things that we can test for and find to be able to point us to, you having a head injury and being able to resolve that. But we need to understand that sometimes the initial symptoms are literally no symptoms. So let's talk about this thing called the energy crisis. So one thing that you will find in the literature, if you hit your head, whether it's mild, moderate, or severe, even if it's a hypoxic event, right? And that leads me into a rabbit trail of chronic stress causes low oxygen states. That's hypoxia. Are we living, some people that are in a chronic stress state, are we living in a constant concussed state just because of the hypoxia that we're producing from the chronic stress? That's a whole nother discussion. Maybe we'll get into it more. I don't know. We'll see. But this energy crisis is real. It's in the literature. I wrote a whole chapter about it in my book, actually. So think of it this way. I live in Texas, and when it snows or ices over here, what happens? Everyone goes inside, they turn up their heat, and we start having rolling blackouts, right? So what happened? We taxed the electrical grid. We put an increased demand on the electrical grid in that, quote, crisis, right? That happens in the brain. So even if you have a mild head injury, your brain, which is extremely metabolically active, right? So it's 2% of our body weight. It consumes 20% of the calorie input that we have, right? So it has a very, very high energetic demand. So if we have a situation where we have some damage, we've hit our head, even mildly, we have this energy crisis that occurs. If this goes unresolved, this will continue, right? This will continue to grow and evolve into other things. Now, with the energy crisis, what can happen is we first want to see an increase in blood flow. We can have an altered autonomic tone. So with a head injury, sometimes we get a change in our autonomic nervous system, and that largely controls blood vessel dilation. It controls how we move blood around in our body. It controls our heart rate, our respiration, our digestive system, all of these things. In the energy crisis, we can have an altered autonomic tone. Because of that hit on the head, maybe we don't get a good modulation of blood flow into the area. And what then happens is the local tissue will then start to respond reflexively, and we can get an overdilation. So we can actually overdilate our vessels, and we get this huge rush of blood flow into the area. And this is called the no reflow phenomenon. And this can actually cause a secondary energy. So this no reflow phenomenon, right? So you hit your head, mild, no big deal, didn't really hurt, but it affected how I can control blood flow to a certain degree. And now I got this huge rush of blood flow. And now I actually had a secondary injury because of too much blood flow flushing into my brain. And now here I am days, weeks, months later after this head injury. And all of a sudden now I'm fainting, or now I have a headache, or now I have vertigo, or now I have visual disturbances, or now I have personality changes or something like that. And it came out of nowhere, right? Well, it very well could be because the energy crisis was never resolved. So how can we start to really resolve that energy crisis? Well, first thing I want you to realize is, well, let me just say, if you do have a head injury, please just reach out to someone that knows how to work with head injury. I don't want you to try and medicate yourself or treat yourself or your loved ones. This is just too important. This is too important to not really do right. I did have a family member just reach out over the weekend. They said, hey, we were playing soccer. My kiddo took a soccer ball to the face, exploded his nose, blood was everywhere. What should we do, right? And so my advice back was, and by the way, he was, he had a headache. It wasn't like major, but they knew that, hey, he took a shot to the head. It was a big deal, or, potentially a big deal. We should do something. And my advice to them was, if you can avoid it, let's not take any type of anti-inflammatories. Let's try to avoid Advil, ibuprofen, Tylenol, this kind of stuff. Why would I say that? Because with a mild to moderate head injury, we want that inflammatory response to be modulated properly. We don't want to just squash everything, right? We don't want to just squash everything. And when we do that, there's actually studies that show we can propagate symptoms from that mild to moderate head injury for weeks. That's what the studies show. So if we can avoid it, let's try not to do that. Now, what I had them do instead is I had them do some frankincense oil under the tongue, because that's really good at modulating the inflammatory response, and it does have a good uptake into the brain. In fact, it increases oxygenation in the brain by up to 25%. I also had them do some arnica. That's a homeopathic remedy. I told them, let's avoid screen time. Okay, we want to avoid screen time in those periods. And then we want to, once, he's kind of settled down and gotten over the injury, I want him outside just moving around, just some good aerobic type of activity, walking, maybe just, they live close to a golf course, so like walking around the golf course, doing something like that. Not anaerobic, so not like sprinting, jumping on a trampoline, that kind of thing. Nice, calm movement outside, getting good sun exposure, moving. Why did I say that? Because we have to modulate the blood flow into the brain too. Now, obviously, and I just have to say it, if it's a severe brain injury, you got to go to the hospital. You have to go check for bleeding. You have to make sure that there's nothing life-threatening going on, okay? So we have to understand, I'm not telling you to not go to the hospital. If you ever suspect, something like that, or if something is severe enough, you should always go get it checked. And by the way, if you go in the hospital and this was a pretty bad head injury, make them scan your head. I'm sorry, just be like, look, I'm not scared of the radiation at this point in time. I'm more scared of a subdural hematoma or some type of brain bleed going on. Let's just scan. There's no reason not to. Come on. I will take a little hit on the radiation exposure to make sure 100% that I don't have a bleed going on in the brain every single time. And I've done that with my kid. I've done that with my wife. Both times went into the ER. They had both had a head injury, and it was moderate. I would say my wife's was kind of moderate. My son's was mild to moderate. And the ER doctor, and again, they're just doing their job. They're doing what they know. They do what I would say was a shitty exam. I don't know who taught them that neuro exam, but they should be slapped. And then they said, nope, there's no concussion, which I was like, bullshit. And then they said, there's no need to do a CT. There's whatever. Well, my wife had actually fainted. And I'm like, okay, no. Listen, we're going to scan her head. We're going to do a CT, and we're not going to leave until it's done. Thank you very much. I was kind about it. I wasn't a jerk. I just really pushed and said, look, I understand. I appreciate, your input here. I would feel much, much better just to know that 100% without a doubt, there's not something really scary and life-threatening going on. Can we please just go and do that scan? I wasn't defensive. I wasn't aggressive. It just have the conversation, right, about it, because it needs to happen. You need to rule that stuff out. Okay, going back to energy crisis, right? So if we don't resolve the energy crisis, right? If we get into a state where we're not moving, we're just taking a bunch of anti-inflammatories and we're still living in this chronic stress and we're doing all these things, that's not really promoting good blood flow and oxygen into the brain. This will continue to change things. This can continue to drive inflammation, bad inflammation in the brain. We can start to get ion channel disruptions. This can actually start to affect the firing rate of neurons. You can actually see seizures start to happen with post-concussive syndromes because of this energy crisis situation. You start to get a change in how ions are going and into and out of the cell, and this alters how a neuron fires. Obviously, if you alter how a neuron fires, you're going to change brainwave states. If you change brainwave states, you're now changing the functionality of the brain. So you can see anything from, slow personality shifts. You can see the slow loss of balance and coordination, changes in muscle tone, because remember what I've said in the past, muscle tone is a direct reflection of brain tone. So all of a sudden you start maybe getting this stooped posture. You start getting changes in facial tone. You start getting changes in voice. You start getting changes in all of these things, right? And you just think, oh, I'm just stressed. I'm just anxious. I'm getting older, all of these types of things. But what if all of those things were related to that mild to moderate head injury that no one really paid attention to? That's a big deal, right? That's suffering in silence. That is a situation that can be avoided. And I'll tell you, what we should do about it. Like, how are we going to identify, who needs help and how do we help these people? I'm going to talk about that. There's even things like chronic traumatic encephalopathy, right? CTE. This has been really publicized. There was a cool movie about it starring Will Smith. It was a great movie. I think it was good. And really what this is saying is really the same things that I've just said, is that, hey, over time, if we hit our head, and especially if we hit our head time and time again, we are setting ourselves up for really bad changes to occur in the brain. And let me go back to this discussion on the energy crisis for just a second, because I left something out. We need to be keenly aware that if we have even a mild head injury, and we don't do anything about it, and we just return to play, or we just continue to live our life or whatever, and then we have a subsequent head injury immediately after, right? Like literally in the middle of this energy crisis, that can be very bad. That can greatly magnify the effects of that second injury. Just think about that scenario I was talking about earlier, where everyone goes inside when it's freezing outside, and they're taxing the energy grid, right? So just think about what would happen if we're in that state and it's already frozen outside, and then all of a sudden we get like a blizzard, right? We get hit again, right? The energy grid gets taxed even more, right? Or to think of it this way, like back-to-back hurricanes, right? Areas just get completely devastated. It's a bad thing, right? This is why if I'm monitoring an athlete and they come in and it's a mild head injury, and I've done this before, I have patients that will attest to what I'm going to say. I will do an exam on them and I will say, listen, I know you want to go back and play football. I get it. I was once, the young male that you were, or that you are, but I'm not going to clear you. I'm not going to clear you until these signs on this exam are completely resolved, because until then, I know that there are issues in the brain that we need to resolve. And whether they were from the brain injury or not, I know that they're objective measurements, and we're going to make sure that your brain is fully optimized before you go smash your head on anything else. And ideally, maybe let's not smash our head anymore. That's a whole other discussion. So that's very, very important. These secondary injuries can be devastating, and it can literally be a mild head injury followed by another mild head injury. And, I'm picking on football a lot, but think about like abusive relationships. This applies here too, right? This is how, you trip and fall, and then you hit it can be accidental. I mean, it can be all kinds of things. So we have this thing called chronic traumatic encephalopathy, and this is where literally the brain is degenerating just at a faster rate. And what we're seeing is blood flow and inflammation are highly dysregulated in the brain. And we have this acceleration of degenerative changes. And it's largely found in athletes and military people that consistently just hit their head over and over and over again. So obviously everyone thinks about the NFL, college football, all of these things. But I see it in more places than that. Obviously, this leads to Things like memory loss, cognitive decline, these are just things you're going to find in the research. Emotional and behavioral changes are huge. Again, you can have someone completely turn into someone else. Like you married this person, events happened, they got head injuries, it went unresolved, they change into this person, and that person is completely someone different than that you married. That leads to so many problems sometimes. So emotional and behavioral changes and an increased risk for dementia. Huge. That's in the literature. What if this happens at birth? There's a whole can of worms. So when I was doing a lot of consulting work in the Middle East in my earlier days, it was so common to have someone come in diagnosed with autism. And then when I looked at them, I said, this isn't autism. This is a birth injury. I see that in the US as well. Someone diagnosed with some type of neurobehavioral disorder. And when we get into the history, the mom had this prolonged, terrible labor and the APGAR scores were low at birth and they had colic and all of these things. And it's like, there was a brain injury at birth. Like just because they didn't get rushed to the NICU and, they had these major signs of brain injury doesn't mean that there wasn't this mild to moderate injury in the brain at birth that did not fully resolve, right? That happens, and it happens a lot. Okay, so what do we do about it? Well, the first thing is understanding the type of professional that is really trained to identify these problems. I love medical neurologists, and they are here to help us in so many ways, but they don't understand the functional component to changes in the brain and how you can actually examine someone and see these changes. They're great for pathology and for all of these things. But really, honestly, this is where functional neurology excels. There is no one else that knows how to examine these people and then, in my opinion, help these people. I think you would be hard pressed to argue that against me. And then not only that, but look at the results we get. So what are we looking at? Well, we're going to put someone through that developmental exam. If you go back and you listen to the podcast, I spoke about the blueprint for brain development. So what we need to know is that if the brain has these series of mechanisms and patterns that it's going to go through in order to develop itself, if it's injured, if it has a problem, it's just going to default and go back to the area that it needs to start over, for lack of better words, and redevelop those networks that were injured. So our developmental exam will literally look at, okay, how far back in development did this person go? And here, not only that, but here are the mechanisms we can take in order to start to rehab those networks. It's literally the brain uses the body to develop itself, right? So again, muscle tone is a direct reflection of brain tone. So we can look at primitive reflex. Well, let's go from the beginning. We can look at sensory systems, because oftentimes you do get altered sensory systems, especially if it's like a parietal lobe issue or something like that, or spinal cord. You can have sensory system alterations. And we look at primitive reflexes, postural reflexes, core stability, vestibular. Vestibular is huge. Athletes should have baseline vestibular testing and eye movement testing. Absolutely. Like this needs to be standard in all schools. Honestly, this whole exam should be standard. So you get vestibular system, eye movements, and then cognition, right? There's cognitive testing that we can do that's easy, like literally can send a link to people to do baseline assessments. Eye movements are easy to test these days. We use a right eye system. There's other systems. Vestibular testing is easy. Seriously, you stand on a board, it measures your perturbation and titubation. Core testing, dude, it's not hard. Primitive and postural reflexes, that takes training. Like I've trained clinicians and sometimes they're still not good at it. There's an art to understand how to properly test primitive and postural reflexes, and not just test it, but how to interpret it. And there's definitely an art form for testing sensory systems. So this is something that should be standard, in my opinion, for anyone going into the military, going into contact sports, for all of these things. Like, because if we have a baseline and then we have even a mild head injury, we can re-examine and we can go, okay, here's the baseline. So the return to play doesn't happen until we at least get back to baseline or better, right? We need to exceed it, in my opinion. I've literally had high level athletes, can't name any names, come into me and I've done this exam. They were just trying to optimize performance. They didn't think they had a head injury. They were just trying to optimize performance. And I examined them and I'm like, holy crap. How are you playing at the level you're playing? I can't wait until when we fix all of this stuff, you're going to be at such a higher level. So pretty cool. So that's the thing, man. We need to be able to be working with providers that know how to screen for these things, but not just how to screen for them, but then, how can we implement strategies to actually let the brain rehab? We have to move someone out of that energy crisis. That's step one, by the way. I just walked through all the different big buckets of care that, or how the brain develops, but we also need to address this energy crisis that is first and foremost. That's a huge reason why I use laser and light therapy on every single brain injury case that we have. Not only is there literature that supports the use of photobiomodulation for brain injury, and some research even says it should be the primary modality used for brain injury, but what it does is it's going to start to address this energy crisis at the heart of what's going on, right? So when you start using photobiomodulation for the brain, you're going to see that you get a modulation of blood flow. First, we have to understand that. We have to understand that I said modulation of blood flow. It doesn't just increase, it modulates. And it does it by having an influence on that autonomic nervous system and the tone of that system controlling blood vessel dilation and constriction. We get a modulation of the inflammatory systems. Again, emphasis on modulation. We start addressing disruptions in the glymphatic system. That's the system that turns on when you're sleeping, and it starts to clean up all the debris from the injury. That system has to be properly functioning. We start to get a whole cascade of events. We increase cellular energy production so that those cells can actually heal at a faster rate. There's so many things that goes on here, but what happens is that application of photobiomodulation will help us to move out of that energy crisis, which is 100% necessary if we're going to, be our full self, if we're going to be fully optimized. And not only that, but to decrease our risk of that secondary injury, right? Because if you're in that energy crisis state, it can last for days, weeks, months, years. It really can. And you are so much more susceptible to greater damage if you do even have a mild brain injury and you never address the energy crisis state. So that's first and foremost. And then, again, making sure to work with someone that really, really understands how to navigate a baseline assessment and then how to address any kind of inconsistencies or findings that they have after that. So that's my take on this whole concussion epidemic that we have right now. Fortunately, we have so much more information at our fingertips. We're able to identify concussion even on imaging studies now, but there's still a lot left on the table. There's still a lot that we can't actually see on an imaging study. We do really need to understand how to functionally assess someone and then actually help them recover, rehab, and optimize their brain and their nervous system. So that's what I had to say about concussion and why ignoring it could have huge impacts on your life, on the people around you, and not only that, but just on society and this world in general. So I hope you found this educational. I hope that this helped you understand something better. If you need a functional neurologist close to you, we do have various different locations of our neurosolution centers. So you can reach out and see who's close to you there. At least I can tell you that, our staff is properly trained and absolutely knows how to handle this. Honestly, like in our sleep, like we know how to do this. So I hope this helped. If it did, please share it, like it, because that's why I'm here. I want to help others as much as possible. So until then, I will speak to you later.
We hope today's episode has inspired you to take that next step toward your best self. Remember, the path to longevity is paved with small, daily decisions. Your journey is unique, and every step, every choice, brings you closer to your ultimate vision of a healthier, happier life. For more insights, tips, and resources, visit drbrandоncrawford.com.